Filter.
All right. Hello, everyone. Again, I am Rajani. I am with Baltimore Harm Reduction Coalition as Director of Mobilization. With me is Mattox from Oakland. We're going to give her a chance to introduce herself in a moment, but I just wanted to get us started. We are here. We're letting folks in, so you're going to hang, even if you're watching this recording after the event, you will hear all the dings of people coming through, so don't mind that. This event is called More Than a Needle, More Than a Crackpipe, Racism and Safer Drug Use Supplies, and this is part one. We are planning to have another event in October with some of our local partners from different groups that have worked with on the police reform work this year, and so really to connect paraphernalia decrim as a piece of the broader police reform puzzle that we've been talking about a lot in Maryland more recently and also for hundreds of years. And so this is part one. And yeah, I think the thing to remember is that inherently a glass pipe is not dangerous. Racist drug policy is dangerous. That's really the tagline we're going with, and really to understand. We want to make sure people understand that issue. We also, of course, just in general, we expand and spread the love of syringe service programs around the state, the love of naloxone around the state. But we also recognize that we have a bill, Senate Bill 420, we're going to get into first in a second, that is about decriminalizing paraphernalia in Maryland. And in December, the Maryland legislators will have an opportunity to override the veto from Hogan. So that's why this conversation is so really urgent right now, to make sure we understand how important, right? Many of us understand how important it is to decriminalize paraphernalia, and we want to make sure we have the really strong foundational arguments for this. So, and yeah, just to acknowledge that now that we have naloxone so freely available, if we didn't see it, if we didn't see overdose prevention and overdose as a white suburban issue, then we wouldn't even really be at the place to have such conversations, right? To have 3 years of decriminalization of paraphernalia, 3 years is really not that long to get to a place of legislators passing a bill like that. So, you know, really remembering that we are grateful for the state we're in and that we have moved along so quickly. We really need to take this opportunity to use this moment while we can, right? To push back against white supremacy and to push back against the drug war, which does still persist. So those are some of the grounding pieces I wanted to start with. Because we are making this a short 1 hour recorded event without Q&A, we are actually offering on Thursday a post-event event, which is digesting the lessons with Cam and Harriet from BHRC. So that'll be this Thursday. So please join us to digest the conversation that we're having today, that Loris and I are having today. We're going to review the points of the conversation and how to apply the work, since Loris is in Oakland and we'll be talking about issues and as they faced and currently face in California. We know wildly different states, but also Oakland and Baltimore, not so wildly different cities. So how do we apply some of the lessons that they've learned to Maryland and Baltimore? So that is kind of a really exciting opportunity on Thursday. Okay, so this is our deal. We're gonna go through, I'm gonna let Loris introduce herself for a second, and then we're gonna get into some policy history from Maryland and California. Loris is gonna tell us some stories about her experience in Oakland with syringe service programs there. We'll have some reflection moments and really talk about takeaways, messaging, moving forward, action. And then we'll close out around 7. So, Loris, could you just tell us, you know, your name and a little bit, what you do now and what you've been up to for a little bit?
Yeah, so it's interesting because first off, I'll talk about like the Oakland experience. I served as the executive director of HIV HIV Education and Prevention Project of Alameda County, HEPAC. It is a rather large harm reduction organization in Oakland. I operated that for 15 years, and then not so recently, I can say now, transitioned to government, working at the State Department of Public Health Office of AIDS out of the harm reduction unit. So I've spent an extensive amount of time, in Oakland, doing the harm reduction work and talking about some of the experiences that we had when we transitioned to expanding access beyond syringes at our syringe exchange programs. And now at the state level, I'm able to share like the policy piece, right? Like the laws that we have created over time to address the fact that, there's the harm reduction supplies are still considered drug paraphernalia. How do we work our way around that to make sure that there's access and that folks are protected? So that's why I am here. And I think too, it's interesting, like you mentioned something, Rajani, about the fact that, Oakland and Baltimore, I think the thing that ties us, or the thing that the common thread that we have is like working and doing the work amongst our people, right? And then having to spend a lot of effort into getting folks to just like reframe the failed drug war, right? And what it looks like in terms of righting that wrong. And you touched on something too. I'm getting excited. So we'll go to the slides. But I just
know, right?
And you touched on something, you like in a very diplomatic, nice way said, it's this thing now that things are changing because of, because the face of drug use change, right? Like it became more white. So folks wanted to really start making movement to shift away from the failed drug war of like the criminalized, like lens, and getting more to like a help support public health lens. And so for me, I think that one of the commonalities that we have when we're considering Oakland and Baltimore is that's the root, right? Getting us to shift our thinking around that. So yes.
Yeah, I'm so glad. I know when I threw that out there and I'm like, I'm really jumping ahead. But I think honestly, what I love about being able to have this conversation today with you and our, over 30 and growing number of people who are joining us on Zoom today is that is something we know. Honestly, it's now just a point of fact, is that we know that drug war has been going on for decades and actually hundreds of years. We know that. There has been a shift towards a more compassionate approach now that we've seen more experience of opioid related overdose among white people. And we've seen the compassion. We see all of us hear that in meetings and conversations ranging from community meetings up through policy meetings. We all hear that phrase of now there's this more compassionate approach. Then what? And I feel like this conversation is hopefully going to be a place of, okay, yes. And what do we do? And so I love that, because I remember being in rooms where that was the big bomb drop of like, this is a more compassionate approach. Like,
like now we're ready now compassionate. Now you won't talk compassion. Okay.
Right. And now people are like, yep, it's true. So what? So that's, I'm excited. I'm excited to get into it. So let's get into it. So let's do just an overview of policy for, let me just make sure, do that. Okay. So overview of policy when it comes to paraphernalia in Maryland, and then I'll throw it over to Loris to give the California overview. So shout out to Owen O'Keefe from Baltimore Harm Reduction Coalition, who is just brilliant and amazing. And I was like, I need a quick timeline, please, Owen. And he delivered. So I just want to give him a shout out. None of anything we do ever is can ever be done alone. There's such team effort at BHRC. So brief history of paraphernalia law in Maryland. And this is really only in the past decade, right? This is not including the early 90s when Baltimore City had one of the first needle exchange programs in the country. So that was early 90s, and it was very much, and actually remains part of the HIV prevention department at the City Health Department. And so it was at the height of the HIV and AIDS crisis that's when Baltimore City started the syringe service program. So lots of different pieces have moved in harm reduction policy since then. But if we take ourselves to 2016, that is when SSP, being syringe service programs, the expansion legislation granted an exemption for possession of some paraphernalia for authorized participants. So that's when there was legislation expanding syringe service programs across the state, where community-based organizations could basically apply to the state health department or to their local health department to become a syringe service program. We now have over 20. We have over 20 programs in the state, which is just a beautiful thing to me. And so anyone who is a card carrying participant of any of these syringe service programs is authorized to carry those supplies. And so that is the law today. That was 2016. 2018, paraphernalia law criminalizing items to test or analyze drugs is repealed. It's basically as fentanyl testing strips is often what we refer to. There are testing strips for all sorts of drugs. This comes from science labs, right? So we at BHRC actually have had possession of cocaine testing strips, heroin testing strips. Fentanyl testing strips are definitely a major piece of the harm reduction toolkit right now, especially. So we have those available, and it is legally, people can carry them. So 2019 was when BHRC and many partners, many of you here today, have been part of an effort to introduce our paraphernalia decrim bill, which is to decriminalize possession of paraphernalia for personal use, which is a very specific kind of understanding of the context. So it's 2019 was the first time. 2020, the bill was reintroduced. There was a lot of positive support actually, but then due to the COVID pandemic hitting Maryland in the middle of session, legislative session 2020 was shut down, was cut short by about a month or so. So we don't know what could have happened, but our sponsors definitely feel like it could have moved forward pretty well last year. Thankfully, this year, Senate Bill 420 was voted out of both chambers of the Maryland General Assembly, meaning that our Maryland legislators passed a bill to decriminalize paraphernalia for personal use. And ultimately, about a month later, it was vetoed by Governor Hogan, which we all expected. We wished it didn't happen. We hoped he would forget it. And he vetoed it. This December, we have the opportunity for legislators to override that veto. So that's the current law as it stands in Maryland. Turn it over to Loris to share California.
Yes. So, it's interesting. When I was looking over your, I call it your timeline slide, and comparing it to California to state law, I'm a little bit jealous of the fact that y'all are just like leading with we need to decrim drug paraphernalia, as opposed to California. What we did was we kind of like created these, someone called it this, and I actually like it, so I'm going to steal it. We use these like broad stroke like laws that addressed the drug paraphernalia, kind of like curb the drug paraphernalia or work around the drug paraphernalia laws. So in California, like when you look at our timeline and look at, I'll get to them. I just want to give a little intro to it. So it's like most of our laws are rooted more like as a like from a public health route, as a strategy to reduce the spread of infectious disease, right? So we didn't, come out, I call it hard hitting and stating the obvious, right? Saying this is why we need to decrim. We are just like, oh, we're going to take the public health approach. And so what that allows for is for, legal distribution, and for people who use drugs to legally possess drug using equipment, harm reduction supplies. So our decrim lens, focuses on possession and distribution from a public health perspective. And then we also have laws that protect, right? Program participants, program staff and volunteers, and pharmacists. So when looking at like starting at 2014, like you'll see like this like trajectory, right, of kind of like righting the wrongs, or like I call it righting the wrongs. So in 2004, we had this capped possession, right? I call it capped possession, where we allowed for folks to obtain up to 10 syringes from an authorized unauthorized source. And then in 2011, we started tapping into non-prescription pharmacy sales. So that allowed for pharmacists to distribute or sell syringes without a prescription. And, like, again, when you're thinking about it from a public health perspective, we just wanted to expand syringe access at the time. And then when we get to 2014, that was when we removed the cap, right? Like, we removed the cap on the number of syringes that folks can obtain from an authorized source, and also what pharmacists and programs can distribute. And something too that we have in California, if you're a physician, as a physician, you are allowed to distribute syringes without a prescription. And so, yeah, as you can see, like, during like the early days, I call it, that was when we were just really trying to find like workarounds, right? Just but from a public health perspective. And then when we get into 2018, next slide, please. Yeah, so when we get into 2018, this for me was like the big, where we were trying to get to, like, just say like decrim, but then we were also like saying we need to get folks to start thinking beyond the syringe, right? I work in these spaces. I communicate to a lot of folks who aren't privy or are still on the fence or don't know jack about harm reduction services. And what I hear a lot, what I find myself doing is doing a lot of changing the language, right? Like talking about harm reduction and letting folks know that, yes, like Narcan distribution or naloxone distribution, which is kind of like a low-hanging fruit or like a dipping of the toe in harm reduction, right, is a form of harm reduction. So in 2018, it was when we had protection, right, from criminal prosecution for folks who carry syringes or distribute syringes. So we're thinking about protecting program staff, program participants, and physicians and pharmacists. But we also expand beyond the syringe and allow for non-injection supplies as it relates to smoking, as it relates to snorting. And is inclusive also of glass or pipes. So we amended that in 2018. And, so what that looks like, right? You look at this and you're like, whoa, darn, like y'all are, y'all really, we talked about that, Rajani. Y'all are really, like doing it, like making sure that you can work around like the existing drug paraphernalia laws, and, on paper, it looks good. And, when it kind of like trickles down to communities, right? You're getting into counties, you're getting into communities where, law enforcement is aware and it hasn't shifted, right? It hasn't shifted. So when we're thinking about like the protections that we have for program participants, the law is there and the interaction with law enforcement continues in some communities. And so, that is something that I feel, is a very long and will be a consistent road that we have to continue of like, like informing and educating and continuing to protect our program participants and the folks who are doing the work, the harm reduction work. But, it's like, I guess what I'm trying to say is, just because we have the laws, when it trickles down to the communities, it doesn't necessarily mean that law enforcement is aligned. And yeah.
Right.
Yeah.
Absolutely. Right. And we could, right. We're going to get into
down another angle with that.
Talk about for thousands of years and all of this. I think it's really important. And I definitely, I'm working to like, let me not get into like, this is what this is like in Maryland too, because that could be this conversation. Also, we could be here all night. I definitely want us to be centering and learning about how it's been in California. And I do want to name when it comes to, the workarounds to ensure that it's beyond the syringe, right? That it's all these supplies that people are using, all of these supplies that people are asking us for is always the reminder, right? It's not just like, I'm not just sitting here thinking and like, oh, you know what? I want to start now having smoking kits as someone who
Yeah.
hasn't. I'm like, no, it's actually people are coming to us, or we know that we see folks, or people are either asking for, or we know for a fact that they are using non-injection, right? They're smoking, they're snorting. And so we need to ensure that there are safer supplies for that too. And so in our legislation as well, right? In our bill, we've named, right? Because it's all about the possession of the items. We name all the items. Right. And that's a really great way to ensure like this is protected, right? We're talking about all of these supplies, which honestly, a lot of folks don't even know what, a lot of policymakers don't know what all those supplies are for anyway. But it's all these interesting workarounds that we have to ensure that our people are protected under the law.
Yeah.
And it comes down to that interaction with police, right?
Yeah. And understanding too that you said something, you said something that I just want to like uplift. It's like, we're, like as harm reductions, we're not sitting, like we're not gathering and like kind of trying to figure out ways to like, like piss people off and like we're just simply hearing the voice of the people that we're serving and wanting to address a need.
Right.
It's
addressing a need, right? I mean, we're just like preaching to the choir, but it's always this thing where people are like, no, you're doing this. It's like, no, people ask for it. We say we should give people what they need. Okay, so California legislation, this is where we're at, right? This has been, and one thing to note, of course, is that, and I can't go back, but 2004, right? And so that 2004 being the beginning, I think is really interesting, or the beginning of this particular timeline. And that's where the conversation, when it comes to Oakland, it seems like leading up to and really talking about early 2000s is where we'll live for a little bit right now. Yeah.
Yeah, so now I have removed off my CDPH Office of AIDS hat, right? And now I'm going back to my going back to Oakland. It's interesting. Like I do want to start off with the state of emergency that was declared. So I do want to highlight that. But before I do, I just want to say that, Oakland is in Alameda County, and in Alameda County, syringe access services has been happening since the early 90s. I believe it's shout out to Berkeley Mead, who started in 1990, and then HEPAC followed soon after. So yeah, so a state of emergency was declared by Alameda County Board of Supervisors, and that basically allowed for legal syringe access services, and also for the county health department to free up some funds to allocate syringe service programs in Oakland, in Alameda County. And so I say Alameda County, but it was primarily Oakland where the services was happening. And then you think about South County, it's like Hayward. Yeah, but I'm gonna focus on Oakland. And so
I don't know it like that. I mean, I know it, but maybe could you, and just in case, would you mind actually just describing the demographics, the context of Oakland, just a little first?
Yeah, so I'll try to do it in chronological order, right? So we're thinking about the 90s, we're thinking about like the mid to late 90s, and what was happening in Oakland, primarily in East Oakland, was, we, even at our syringe service sites, we were still feeling the effects of the failed drug war, AKA the crack epidemic. I don't like to say crack epidemic. I just like to say the effects of the failed drug war.
Right.
Yeah.
What do we call it? Yeah.
Yeah, and and what that looked like too were primarily just Black communities of parents and grandparents who have children and primary caregivers for grandchildren due to the effects of the failed drug war. So I'll say that, even though there's multi-layers, right, to that. And so gentrification was just kind of happening, but it didn't really penetrate East Oakland yet, and parts of West Oakland. So when we're thinking about HEPAC's decision to start giving out non-injecting supplies, we started off with smoke kits, and smoke kits are, it's Brillo pad, it's the cover. I feel like I'm preaching to the choir here. I have a feeling like we folks here know, so okay.
We started distributing smoke kits. be reminded of what all it is. Yeah, go for it.
Yeah, so it includes Brillo for screening, like as a filter. It also includes like I call it a spark plug cover for the pipe, so that when the pipe gets heated, and it cracks, you're not it doesn't affect your lips from cracking and blood exposure. And also just lip balm and Charboy. Yes. Okay, someone in the comments said Charboy. Thank you. I was trying to be proper. Charboy. Yes, we call it Charboy filter. And also just obviously information about ways to be safe, right? Stay hydrated, eat, things of that sort. So we were giving out smoke kits at the time, and what we were witnessing was we didn't catch any heat, right? We didn't catch any heat around the smoke kits. But when we started giving out glass, when we started doing glass distribution, that was where, and I say glass distribution, I mean the bulbs and the straight shooters, that's what we call them. So we started giving out glass, and I was responsible for attending, as part of our conditional use permit for having our drop-in center in Oakland. I was tasked to attend every month the neighborhood committee meetings, Fantasy Speak for Crime Prevention, Crime Watch meetings that included, residents of East Oakland, also included law enforcement. There was always 2 law enforcement representatives. And I attended this meeting before the launch of our glass pipes, of our glass distribution. The meetings were usually me hearing from community members saying, oh, there's some cleanup that needs to happen, in this area or this park, or, it was just really, I call it surface, right? And just kind of could be easily addressed. And so I attended this one meeting, and I remember a community member just, was very, very heated and said, so I hear y'all are contributing to the killing of our people, the killing of the Black folks in the community. And I was like, okay, what's going on here? Can you elaborate? And they were like, you're giving out glass pipes, you're giving out pipes now, and you're wanting folks to smoke, you're enabling. And this was actually coming from folks who have been generational, we call them OGs here in Oakland, folks who have been, third generation, second generation, third generation Oaklanders, of course, because these are crime prevention meetings, crime watch meetings, we call them homeowners, and they've been in the community for a very long time. And, and when you think about, I know we're going to touch upon generational, I don't want to call it ageist or ageism, but, we're thinking about, the community of folks who were really opposed to us distributing non-injection supplies, and then that happening right when gentrification started hitting. So this meeting was one of those meetings where we had a mix of OGs, right, and folks who are new to the Oakland community by way of San Francisco. And so it was this thing where I found myself needing to educate, right? Inform the reasons why we were giving out the pipes. But, science and education folks sometimes don't really, want to be open to or privy to. And there's a reason to that. And we'll get to that, Rajani, I know. And then you've had the newcomers, I call them gentrifiers, sorry. The gentrifiers, call it what it is, state the obvious. Right. And they were like, well, I'm not from this community, and you all are doing you all are doing the work that I don't know. So I'm just going to really trust your judgment, right? So they weren't really opposed. And so the focus was really on our people, right? My folks who I lived 3 houses down from started giving me dirty looks when I left the house, just kind of educating them and just informing them as to why non-injecting harm reduction supplies was needed in the community and how it addressed the need. So, where I say of 2008 to 2016, see what had happened that's what I'm getting to right now. That's what I'm
got you. Yeah. Okay.
Yeah, that's what I'm getting to now. And so for us, in my community, we're really focused on, okay, so we are public health, we need to inform, we need to educate, and and it didn't work. And as I was talking to you before, when we were talking about this and having the conversations about this, I hope we can get into that now of like lessons learned, right? Like what I really believed that I and my coworkers, my team at HEPAC should have done differently was just understand the fact that we actually did have a common ground, like folks were opposed telling us we were committing genocide. I mean, like it was organized as well, where they complained to city officials, to county officials. And what we realized was that we didn't offer a space to hear from them about their root, right? And this now circles back to the failed drug war, when you have like I'll say it, I'll speak on it. I don't mind sharing. I actually do share. Like my family, my dad's side of the family, we're from West Oakland, and a traumatic experience occurred in our family. And out of my 10 aunts and uncles, like 7 of them actually became folks who used and started experiencing homelessness. Like we were affected. And the thing that I want to go down that road, but I'm trying not to. So I guess what I'm trying to say though is that like we were affected, and for me, my experience in dealing with the crack epidemic, the failed drug war, and then understanding back then that we needed to not take a criminalized like perspective of it. And so for my personal like root, I was like, I'm doing this. I'm seeing how I have, like informed my family to like not to welcome, to say, okay, you can come in and shower, you can come in and hang out with us, you can come to the family functions, right? Like it's all good. And so I thought, well, it's simple. Like, I'm in this community. I've been from this community, born and raised, East Oakland. All I got to do is share my story and inform. And that didn't work. And so like the regrets or the coulda, shoulda, wouldas, right? Like when we were told by the county health department, when we were told by city officials and, Board of Stoops to provide a space, the space was always to inform. Provide a space for them to like, share, give them data, tell them about the research and explain to them why this is needed. No, like my coulda, shoulda, woulda was, I really wish I would have provided a space and said, tell us how the failed drug war has affected you. Tell us how it has affected your family. Tell me how it's affected you. And like starting there at that root so that our folks can understand that we actually have a common ground where we're just trying to address something that needs to be changed. Yes.
Yes.
So yeah.
First of all, I just want to say, I mean, obviously this is such a slice of such a bigger piece, right? And I just want to say thank you for sharing about your family too, because right, because we're so
hey, we all come on now, like
humans, you know what I mean, right?
Like thank you. That's the best way to say it. We're human.
We're human, and we're bringing that in, and so it can be really frustrating. And so I don't think we use OG language here. I mean, I don't always. It depends on the room. It depends on the room you're in. I bring a lot of California over to here since I'm from there, but I'm like, all right, are we doing this OG or even elders? Right? There's a lot of conversation we talk about in conversation with elders and folks who that's often what we've faced, like the story you're talking about. I mean, the description that you've had of this community meeting, I know everyone at BHRC can think of at least 3 they've been to, and then so many of our partners here were like, yep. And it's that thing, and then you're also bringing your stuff, right, as a person, as someone dedicated to harm reduction. We're also bringing the stuff of our participants who have said, our participants, our community members, our loved ones who have asked us for these supplies. And so it's this forcing of this trauma war, right? Amidst the war. It's forcing, and somebody in all the work we do when we're doing community meetings, it's this idea of moving the trauma around the room. We're not really addressing it, but we're just kind of moving it around. Right.
Oh yeah.
And then it becomes that. So then there's those meetings where you're like, okay, we're going to hear everyone's story. And then we're hearing everyone's story. And it's like, okay, where's the middle ground here? I don't want this to be, I'm here to inform you, here's all the science. And I don't just want this to be moving trauma around the room. How do we move through this? And so it sounds like as you and I have been having these conversations, that's something that's been really on your mind, it feels, and something you've been bringing up, 20 years later,
Yeah.
talking about.
20 years later, and it stings. I'm not gonna lie, like I'll be real, like it stings, like when I have that light bulb moment of, damn, like I really wish I would have allocated, just had time for that. And and I say this, and like I just want to say, like, like OG, it's not an age thing. It really isn't.
Right.
It's really a trauma thing. Like it's a trauma thing. It has nothing to do with, with OG, or I say that, or age, or like, been here longer than you in this community. It's a trauma thing. So yeah. And I think, so all that being said, like when we start trying to figure out like steps, right? Like my brain always thinks of is, okay, what's the next action step? What's a realistic step? And for me, it's like just stating it, just stating it, just stating it, just saying it, and acknowledging it, is always yeah.
Yeah, that's, well, I think you and I might process the same way, because I'm like, can we just talk about the thing? And I'm just screaming. And everyone's like, I'm not ready for the screaming. Which is why I'm actually going to offer a moment, because we are talking about trauma. We are all remembering a lot. We're feeling a lot. I'm actually just gonna offer a moment for breathing, right? So let's all just pause, right? Stretch out, kind of do some stretches. Right? Regrounding ourselves. Because when we remember that we're human, then we remember that we're human. And then that's a whole spin. We're like, ah, shit. I am a whole human with so many feelings. I got on a whole thing today about even talking about trauma, right? And talking about trauma-informed care. And I'm like, okay, well, that goes down the road of such pathologization, right? It can go down this road, which is one of my, like, I like to have a little bit of a distance when we get really public, like the harmful public health. I mean, I'm somebody who trained in a lot of public health, so I'm not saying it's all evil, but there's that harm of trauma. But it's like when we talk about it within this context of like, we all have pain that we're bringing to the room. And we have to acknowledge that truth in order to get through it.
Right.
That feels like we're going to get somewhere. We're going to get to some action, but we're all going to be real messy, right? So
tired, emotionally drained.
I'm just messy, right? So it's like breathing, taking that pause for breathing.
Yeah, I appreciate you for stating that. Yeah.
Yeah. And so, a moment just to take for our attendees and for ourselves, right? Just to check in as it's already, we're already have about 18 or so minutes left in our conversation. I know. And we can talk about, we want to get into talking points and everything. But the first thing is so important is if we are saying one of the number one things we need to do is listen and not just inform, not just say you need to support decriminalization of paraphernalia because XYZ, or you need to support having safer smoke kits because XYZ. It's like we really need to interrogate and think through some things.
Yeah, and we kind of touched upon some of the items that we have here. I think, like when I'm thinking about like next steps and when I'm thinking about like getting grounded, right? Like when there's a time when we're supposed to be messaging, right? When we're informing, we're harm reduction workers, like we're harm reductionists. Like our goal is to inform. Our goal is to, that is great. And when we're thinking about like just rooting like our approach, just like think of it as how I like to think of it. I'll speak for myself. Like how I like to think of it is to definitely acknowledge the fact that common ground of like we are hurting, there is trauma, and as a harm reductionist, we are rooted in the fact that there is trauma, and we're trying to address the need. We're trying to assist that. We're trying to work around it. We're trying to address it. So it's like I always feel like when we're in spaces of folks who are not harm reductionists, like that's something to just be mindful of, right? Just find that common ground and acknowledge it and state it. And what happens too is like when that is stated, so I'm kind of going to go back to the Oakland experience. You don't have to do the slide, but when, we were having these meetings, informing meetings, And there was a woman who reached out after, and I remember, she came up on the side after, kind of like, kind of in hiding. And she said, I need help. I need help. It was her grandson. She's like, I need help. Yeah, she was opposed, and she had someone who she loved that she wanted to help. Right. And so what happened was, like, when I'm talking about my coulda, shoulda, wouldas, that was the moment where I listened to her and she stated what she was experiencing. Right. And then that opportunity became one where the woman became, we call them champions. I don't know what else to call them, but, like, she then became someone who assisted us with working with their peers and getting them to understand why we were doing the work. I hope that makes sense.
Absolutely. Absolutely. Well,
yeah.
I think that's a really good, turn to the messaging and takeaways, right? Is these different audiences of people that we need to identify and the groups that we need to, it just makes it a little easier, right? When we're like, how do I get this message across? Well, let's, in a lot of messaging development, we kind of put folks into different groups. And so the different groups that we're talking about, one group you're mentioning is folks who, I was trying to figure out a name for it. Let's see what I put. I put something like folks who are loved ones, right? Or impacted community. I think about even our Mayor Brandon Scott is a big advocate for overdose prevention sites, Baltimore City Mayor. And when he testified for the bill, for the Senate bill and the House bill for overdose prevention sites at the State House earlier this year, or online, he brought up his personal stories. And he said, as someone from Baltimore City, as someone who was raised with stigma against drug users, like, he was very clear. He's like, I changed my mind. I know we need this. And I was like, whoo, I wasn't sure. Like, he is a very approachable person, but I didn't know if you do the politician thing, but he was a very real, and it just felt sincere. Like, he wouldn't just say that. That's something that could be risky, but for someone who's so powerful, so who people hear saying they changed their mind, right? And you in this,
and it shouldn't be risky.
And it shouldn't be risky. Good Lord, it shouldn't be risky. We're human. We're allowed to change our minds.
Right, because we're people. Like, yes, you're a politician, but you're a person. Okay, so I just had
totally. And it's like, why are you not allowed to change your mind? But he talked about, like, changing as he's a young man, and honestly, and he's like, I changed my mind. I grew up with this conditioning. I changed my mind. And this is one of the many reasons I support overdose prevention sites. I'm like, that's fantastic. He didn't feel the need to memorize data. He said that. And this person you're talking about, as a loved one, a lot of people, and, not to break it down this way, but honestly, legislators listen to mothers, listen to folks who have lost someone, and particularly parents. And so when we meet these champions on many levels, who are willing to tell the stories, or folks, and then even people in recovery, or folks who with lived experience, those are champions. Like, I changed my opinion of this. Even though my story of recovery is different, I still support this. Right. I support this harm reduction approach. And those stories are so important. Like, that's the, and that reveals I think the insidiousness of the drug war. Actually, people say, "Ooh, I had that drug war mentality, and then I realized it was wrong." Yeah, and it reveals that.
Naming it, like, that's the thing, like, naming it, because I think too, what happens when we're in a lot of spaces, we get bogged down or distracted by titles, by words, by labels, right? And it's like I wish there's a way that I have tried, y'all. I have tried to, like, script things and, like, dump, I call it dumping, like journaling, trying to figure out ways to create a message to explain the fact that all of this that we have, right? Racial justice, social justice, like, everything is all interconnected. It's all connected. It's all connected. So when we're talking about at the beginning, when I was saying how, I'm a little bit jealous of the fact that you all are just coming out the gate with decrim, paraphernalia, decrim. And, California was like, oh, we're going to take the public health, like, approach. It's all the same damn thing. And so, like, when you're talking about, like, having folks, having voice, right? Having folks share their experiences. And then after that, like following up with, oh, that's social justice, that's an like just calling it, stating it, as opposed to leading with it. I hope that makes sense, right?
Yeah.
Like giving more context to the titles and the labels, because I feel like a lot of times people just get bogged down by that and they get distracted. So yeah.
And I think it's really, public health. So in Baltimore, right, we have Johns Hopkins, and it has the internationally renowned School of Public Health, right? So as a graduate of Johns Hopkins, I feel it, I hear it, I've been impacted by the grossness it feels to be someone who's benefited from an institution that is very harmful historically. And it's this very complicated relationship where, and that's where we get to the people, that's where I get to the audience who hears a public health argument, which a lot of our legislators do. Our legislators in Maryland hear, not all of them, but many hear and follow through with a public health argument. And especially when we have, allies who are who represent Johns Hopkins or have conducted research using the resources from Hopkins to support harm reduction. It has benefited our policy, right? And it doesn't feel awesome all the time, because often, even to have this statement, public health is social justice. Like I have a moment when I'm like, eep, social justice, public health, eep. Like it's not 100% true. These are not equals, but
right.
Or public health is my public health and it should be social justice. Not all versions of public health is necessarily equal. So, but I guess my point to get to though, is like, we know public health data, but also stories and that people who hear, there are folks who get moved by public health arguments. And so I think there's language you have named around, saying the phrasing around it's a road to recovery, right? Like decriminalizing paraphernalia, syringe service programs, overdose prevention sites, those provide a piece to a broader puzzle of care that can help folks along a road to recovery, which doesn't always feel great as a harm reductionist. Not all recovery looks the same. But when we say that phrasing, people hear it.
Yeah, and they listen, they open, they're more open, they're more receptive. I hear you.
Yeah. And so, it's interesting that what you've perceived, it's really fascinating what you perceive as like, California is doing this public health approach and Maryland is like full on decrim. It's still a public health approach.
It's all the same thing.
It's
all the same thing. It's all the same thing, just labeled differently. Yeah. And I just want to throw this. I don't have I'm not sure how we're on.
Yeah, we have about 8 minutes left, but I think.
Okay. I just want to say this, there's the last bullet that says reveal the intent and history of the failed drug war. That is part of the chipping away, I believe, of the shift from the criminal lens to the more to the more public health. I don't even want to say public health, to the more just loving lens and respectful lens of what we've been so traumatized and what we've been feeling and experiencing for so many years. So it's you start, oh gosh, what jumped out for me, I'm seeing Sankofa, right? Is it Sankofa? If you got to look back to look ahead, right? So it's starting to get people to understand the real intent of the failed drug war and how they did it did its job, right? And that resulted in harm, and now how to address that harm. I just want to put that out there. When we as harm reductionists start thinking about our messaging, always plug some of that in. And call it the failed drug war, not the war on drugs.
Or even, as we tend to say, the targeted drug war, right? Or specific and designed and intentional. Yes. Yes. I mean, say it, right? Be honest. And I think, so that's, the public health argument is honestly controversial, I think, here in Baltimore, because so many of us, so many folks, many people, generational harm inflicted from public health institutions. So it doesn't, and at the same time, so many folks also do hear a public health approach, or when it's put in context against criminal justice. And I don't necessarily,
Mhm.
it doesn't need to be so binary as it's criminal justice or public health.
Mhm,
And
mhm.
it often is positioned that way, right? So
Very true.
as as another piece, um,
Uh-huh.
it's really complicated, which we can't all get into, but
It is. And
so
the reason
yeah,
being too, I'm going to say this, and I know, oh gosh, we could still go on. I'm
I know
sorry.
we're like, this
But,
is
and the reason why it's so like black or white is because that's what folks can easily absorb and comprehend and be confident in their stance in, right? As opposed to just understanding that it's, yeah.
yes. Well, and so I think I'm struggling because I have the voices of so many people in my head right now, honestly, who are like combating against the public health argument or even using that phrase. And then also when I'm in community meetings, when folks are like, we need to use it, elders, OGs, the folks who are like, I'm tired of the criminal justice approach, I want a public health approach. I'm like, okay, let's talk about what that means. What does actually
Yeah.
mean to you? Because it might be a different definition than a legislator from a different county. So,
Right.
but that phrasing can really help us to think more about health and
Yeah.
justice, right? Health justice. Moving towards that lens is always really helpful. And so of course, so I will say this is actually great because the next event we do in this series will be much more about policing and drug
Mhm.
policy. So, as we didn't get into it too much today because we wanted to talk about these pieces, but obviously
Yeah.
policing is a major part of this, right? So there are kind of
Less interaction of law enforcement. Sorry to cut you, like
we
just
all want
less
less interaction
interaction.
with law, right? Yes, yes,
Ah,
yes. Less
yes.
interaction with law enforcement. Did you want to say more to that right now in this moment?
I mean, like I will just say, when we're thinking about the why, that's part of the why, right? Like I'm thinking about, I'm thinking about someone who is experiencing homelessness, there's someone who I actually have in mind, and I remember the stories that they would share with me of the fact that just leave me alone, leave me alone. Like less law enforcement interactions.
Yes.
Yeah, yeah.
That is when it comes to these, and back to centering in the specific spaces of these community meetings,
Mhm.
right? In community meetings that when you're going to go to a meeting, a community meeting that is in a neighborhood with high overdose rates, tends to also be a place that is highly surveilled by police.
Right.
So
Right.
then we're able to talk about in that space, what has usually helped me get through is saying, okay, I understand that you have a lot of reservations about us giving out these supplies. And if we are able to do this safely, if you allow us to do that, that
Mhm.
will lead to less police interaction. And more often than not, in the so many conversations I've had with folks around overdose prevention sites, paraphernalia, they're like,
Mhm.
"Ooh, that would be nice," right?
Yeah.
Okay, good point. Say more about that. And so that is an
Yeah.
opener, is to talk about like police. So there's that. And I feel like there's so many advocates for police reform, abolition,
Mhm.
who don't
Mhm.
necessarily know that much about harm reduction, or who aren't really as engaged with this. And I hope that they start to see, I know you mentioned
The
you gave,
common ground. They
yeah,
see the common ground of less law enforcement interactions. I like that.
common ground. And you had
Yeah.
mentioned that you all had put together flyers with data about police interactions and arrests, and the way it doesn't actually help people or save lives, and you fly.
And how that actually harms, like just the harm as it relates to just someone wanting to just be in a safe space. Yeah,
Yeah,
the flyers, that was interesting. The flyers, they did work in terms of planting some seeds in folks to understand that, like law enforcement isn't always public safety. I'll say that because I know that we can really dig into that one.
right, right.
um, but yeah, that's what the information, I believe. I do know that the outcome of that, there were some folks who started realizing, okay, I see what law enforcement also entails, and that it is not necessarily public safety. Yeah.
Yes, yes, yes. So many folks are letting me know about
Oh,
time.
the comments. I've been dying to get into
No,
the
I'm
comments.
like, yeah. I mean, obviously, this is the beginning, right? And we couldn't end this discussion without acknowledging that we have to acknowledge police, and talking about police is so important to this issue. It is the main reason why we need Senate Bill 420, is because we want less police interaction. And so for folks who are all about reducing the power of police, this is an issue for them, right? And for folks who also say, but police interaction is what that person needs to get on the road to recovery, is always something we hear. Don't they need that first point of contact? And I think what you were sharing, and that's a very common argument, and what you were sharing about giving the data really can help, right?
Yeah.
And having those champions talk about, actually, let me tell you about how harmful the criminal justice system has been in our lives, doing that, which is a lot of work for people.
Yeah.
It can help to move folks from that place of you need police interaction to maybe you don't, and actually you're right.
Yeah, and I feel like I'm always doing this circling back thing, and that speaks to also the educating folks of the intent of the failed drug war. If we're talking about law enforcement.
Yes, exactly. It helped, because bringing it back to why are we so stuck on keeping the drug war together, right? So yes, so many things for people to chew on. I just wanted us to open up these conversations. I love talking with you, Loris. I hope it's been,
oh my gosh,
I hope it's been good. I know we're like brought up.
Oh yes, it has. I'm just so proud of myself that I didn't cuss, because
I'm amazed I didn't. If I didn't, I have no idea. I was just about to cuss just now. Well, I'm gonna go ahead.
I definitely enjoyed the time though. Yeah.
Yes, it's been so good. And so last couple of things is we are clearly decriminalizing paraphernalia is a major issue that we are trying to push for. I keep saying it. December is when Maryland legislators can override the veto. So buy your shirt. Here's the shirt. I was wearing it, but you couldn't really see it. It's so cute, right?
Oh, there it is.
It's so comfy. It's so cute. We have them. We'll mail it to you. We're asking folks to donate $15 to $25 sliding scale. Less if that was what works for you. We really want to make sure this shirt is out there all over the place in Maryland, but also if you're not in Maryland, buy it anyway. We have some.
Yes. Mine is on the way, and Owen says it's so comfy and stretchy. Soft.
Thank you. It is.
Yeah, or hella soft. Yes.
Yes, hella soft. And so super important also is, if you're like, I have so many things to say right now, I have so many questions, or I wish they talked about this, and if only conversations, blah, 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 all the thoughts that are running through the 30-ish people's minds who are watching this, you should bring those thoughts and comments to Thursday's conversation, which I have no idea. 5:30. Let me look at the screen. 5:30 p.m. on Thursday. You can RSVP tinyurl.com more than digest. It'll be in the chat. RSVP, come through. It's all just collective conversation with Kim. Also, do this evaluation, please. And if you do so, you can win the t-shirt. So I think you should do it so you can win a t-shirt, people. Thanks again, Loris. Big round of applause.
Thank you. And I hope you all got some nuggets from a ramble. I hope something stuck.
I know. And I'm sure it did. And there'll probably be so many questions to ask you. And the good thing is we're in community, so we can always follow up. And folks, look up, the last thing actually I do want to say is, if you don't know about, we'll name the organizations again in Oakland, just to close.
Yeah. So there's HIV Education and Prevention Project of Alameda County. There is Berkeley Need. There is Punks with Lunch. Amazing organization, Punch with Lunch in Oakland, and just in general, and I believe you all are aware of the National Harm Reduction Coalition. Always go to their website, always have amazing resources and information to share.
Awesome.
Yes.
And through them, you can definitely learn more context about demographics and wealth and Silicon Valley, which is near Oakland, and racial demographics and gentrification. So many pieces that we couldn't get to today, but are very important to the story. So thank you again, Loris. Just wanted to mention.
Thank you.
Appreciate you. And goodbye, everybody. I'm going to end the recording.